Hey everybody, my name is Dr. Scott Giacomucci. I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And today I wanted to take some time to go over Chapter 8 in this new book, which is focused on the fourth of the 6 trauma-informed principles outlined by SAMHSA, which is collaboration and mutuality. So this chapter is titled Collaboration and Mutuality in Group Therapy, Psychodrama, and in Leadership. So before diving into this, I want to highlight how these 6 trauma-informed principles, although we're going to talk about them separately, they really go hand in hand. We can't fully embody collaboration and mutuality, the spirit of it, without also considering the other 5 trauma-informed principles. So I encourage you to check out some of the other videos on the channel here to familiarize yourself with the other 5 trauma-informed principles. So collaboration and mutuality, these two go hand in hand. And collaboration, of course, means that we're approaching the work through the spirit of partnership, of collaboration. And mutuality is about a mutual respect, that we're seeing the goodness and the positive qualities within the other. Of course, in the moment of trauma, mutuality completely disintegrates. There is no mutual respect in the moment of trauma. And the possibility of collaboration is entirely lost in a moment of trauma. Instead, there's a resulting sense of unworthiness and self-hatred, which can really complicate a trauma survivor's search for belonging, for self-love, and for purpose. Group work and psychodrama offer avenues for participants to experience and engage in collaboration and mutuality while recovering that self-worth and experiencing a sense of belonging within the group experience. Same is possible in organizational settings, that there's a real possibility for a healing and restorative sense of mutuality within an organization, mutual respect between colleagues, and a sense of belonging in a healthy organization. Collaboration and belonging are equally important in organizations as they help staff feel a part of, and they help staff feel purpose-driven and valued. Trauma is really characterized by the absence of collaboration and mutuality. There's no room for authentic collaboration or mutuality in the midst of trauma, in the midst of collective trauma such as racism or sexism, gender violence, or any kind of discrimination. The extraordinary imbalance of power in trauma can only be reversed through a healing process that really centers collaboration and centers mutuality within that healing process. Collaboration means that trauma survivors must be approached as active agents in their own healing process, rather than simply as patients that are receiving treatment from a provider. Collaboration in trauma-informed care means that we do with the client rather than do for or do to the client. This is a challenge for many agencies whose practices are going to be entrenched in the medical model of treatment and bureaucratic standards or even really sterile systems that tend to reenact power dynamics. For example, in many organizations, the process of treatment planning becomes really cookie cutter and templated jargon for compliance reasons rather than a collaborative experience with a client. Or groups start to become all manualized and sterile, and there's no room for mutual aid and collaboration. Instead, we're giving out worksheets and reading off of a script. Instead of therapists being dynamic healers in the here and now. Or we might have such stringent documentation requirements fueled by insurance companies or other regulatory demands that turn therapists into case managers and into administrators who don't actually have time to do therapy. I've seen this again and again in agencies. Therapists become so burnt out, and other staff so burnt out, and this burnout fuels more of the same, that staff are more likely to just go through the motions and follow the path of least resistance in their work rather than to really engage creatively and authentically with the clients and with colleagues. Many times, policymakers and leaders contribute to this, making decisions without frontline workers or clients who are going to be impacted by the new policies. So, collaboration and mutuality are especially important. Now, there was a seminal text on trauma informed care in 2001 from Harris and Fallett, and they state that the core of the service relationship in a trauma informed system is open and genuine collaboration between provider and consumer at all phases of service delivery. So, I want to challenge us to reflect on how can we further approach clients as active collaborators in our work with them, regardless of our role. Neutrality means that we connect with others, helping them feel seen, helping them feel heard, loved, valued, and empowered, and helping to cultivate a sense of belonging for everybody is really crucial to this effect. This means we have to develop atmospheres of mutual respect throughout our workplaces and our groups and in how we're providing services to clients. Perhaps we must look beyond only applying mutuality to trauma survivors and staff and also consider the importance of looking at trauma perpetrators through this lens as well. Many times, perpetrators are also victims of trauma. We spend a lot of time dehumanizing perpetrators, which really doesn't help them heal and doesn't help prevent future trauma. In my own work with folks with trauma, substance use, and in the prison systems, I find again and again that many times the folks who have hurt others are also folks that have been taken advantage of themselves, who have experienced their own trauma, their own loss, their own abandonment or neglect. And so I've found that the best way to help prevent future trauma is to cultivate healing for everybody, including perpetrators. We can't just dehumanize them and write them off. We really have to also work towards healing for everybody. So I want to challenge us to also see perpetrators most of the time as human beings who are also in pain themselves. Furthermore, we also have to apply this sense of mutual respect to ourselves. Many times as helping professionals, we might be quick to offer mutual respect to others, but we might not show the same respect and care to ourselves. This means that we have to recognize our own needs, our own wants, our own strengths, and our own goodness. We're going to really struggle to collaborate with others until we come to believe that our own ideas are also worth consideration. And it's good role modeling for clients and for those that we're working with. Implementing these trauma-informed principles really requires the vehicle of a relationship between two parties for them to manifest. We can't engage in collaboration unless we're collaborating with somebody else. It's not something that can be done alone. I want to challenge us to pause for a moment and reflect on some questions. Or do I fully recognize my own worth, my own strengths as a professional and as a human being? And how can those that I work with further recognize their inherent worth and strengths? How can I help them further recognize that their ideas are important, that their past experience is meaningful, and that they bring something important to the table that's worth exploring and collaborating with?